Welcome to Diabetes Per Charcha talk show, and today we are here at the Diabetes Conference that's held in Chennai. Along with me, I have a very renowned doctor, Dr. SR Ramakrishnan, who is an MD, consultant and a physician, also the HOD of SRI Medical College. A very warm welcome to you, doctor.
Thank you, madam.
So before we begin the program, I kindly request you to give us a brief introduction about yourself to our viewers.
Yeah. I am Dr. S.R. Ramakrishnan, MD General Medicine, Professor and HOD of SRI Ramachandra Medical College, Porur, Chennai, and a consultant physician and diabetologist in practicing in Valasaravakam for more than 20 years.
Doctor, please tell us, what is the normal sugar level that needs to be maintained?
So the normal sugar levels, we take it as a fasting state. So fasting means there should be 8 hours of no calorie intake. The normal blood sugar for fasting is 70 to 100 milligrams per deciliter, and from 100 to 125 we call it as pre-diabetes, that is the before diabetes, and above or equal to 126 milligram per deciliter we make a diagnosis of diabetes mellitus.
How can patients check their sugar levels at home or in the lab?
So home monitoring, when you take a random blood sugar, anytime random blood sugar is irrespective of the meal, it should be less than 140 milligrams per deciliter. If it is more than 140, do a fasting and a postprandial blood sugar or a HbA1c test, which denotes the in percentage values. Anything above more than or equal to 6.5, we call it as type 2 diabetes mellitus.
So doctor, can you just tell us what are the complications that we see when you are diabetic?
So complications of diabetes we classify into two categories. One is the microvascular complications and second is the macrovascular complications. Microvascular complications, we have diabetic retinopathy, eyes are affected, diabetic nephropathy where you lose proteins in the urine, the kidneys are affected. Third is the diabetic neuropathy, which involves the nerves in the foot. Second category is the macrovascular complications, which involves the brain, heart and the peripheral vessels. So we call it as a cerebrovascular disease, which can lead to stroke, coronary artery disease, which can lead to myocardial infarction and heart attacks, and third one, peripheral arterial disease, which can lead to diabetic foot.
Doctor, what would be the message that you today in Diabetic Per Charcha talk show to our viewers?
So keep your body weight within the ideal BMI below 25 grams kg per meter squared. Eat a healthy diet, such as food in low glycemic index, and avoid high glycemic index foods, and have a physical activity, at least minimum 30 to 45 minutes of physical activity per day, roughly around 150 minutes per week, and avoid smoking and alcohol, and be active, and you can control your diabetes well within below 7.
Thank you so much, Dr. Ramakrishnan, who's here with us, who shared such valuable tips. I'm sure it'll be really useful for all our viewers. Thank you so much, doctor.
Thank you.